Hi, my name is Dr. Samantha Scholtz and I'm a psychiatrist working in the field of obesity and weight management. This is Eating Disorders Awareness Week, and I just want to take a minute for us to think about some of the assumptions we might have about people living with obesity during this week. During the pandemic, I've seen many of my patients retreat even more into their homes than before. This is partly driven by fear for what COVID might do to them, as they were acutely aware that they faced an increased risk from COVID, but also due to the increased stigmatizing attitudes that they were seeing during this period. And these stigmatizing attitudes are driven by some really wrong beliefs about weight management. So we think that if people were living with obesity just exercised a little bit more self-control, just ate a little bit less, just exercised a little bit more, just followed a healthy diet, or that diet that I followed during the holiday period where I could lose a couple of kilograms, that they would lose weight and keep that off long term. So there was a great study that followed up people who'd taken part in the program, The Biggest Loser. All the participants lost significant amounts of weight, an average of 60 kilograms. But 8 years after that weight loss, most of them had regained all of the weight that they'd lost. But apart from that, their metabolic rate was also significantly reduced and remained so even after they regained the weight. What that tells us is that there's a physiological drive to regain weight that we are born with, that makes it very difficult for people to sustain significant weight loss long term. It's not just the loss of metabolic rate, but also the increased hormones which make us hungry, which increase our cravings, and which make us not feel as full as quickly. And this is before we even start to think about the social role that food plays in our lives, the emotional role that food plays in our lives on an ordinary basis, and some of the additional stresses and factors that people living with obesity face, such as lack of mobility. So in this week of Eating Disorders Awareness Week, I just want us to take a minute to check our assumptions and help reduce the stigma that people living with obesity face on a daily basis.